It's Charter Local Edition. Brad Pomerance here. We are joined by Ed Hernandez. He is a member of the California State Senate. He is a candidate for lieutenant governor. That election is in 2018. Chair of Senate Health still?
That's still chair of Senate Health.
Okay, so let's talk about an issue in connection with health care, and that's the question of prescription drug prices. I'll give you a quick anecdote, and I'm okay talking about this on the air. My wife has Crohn's and colitis. She takes what's known as a biologic, which is a very strong medication. It's an injection every 6 to 8 weeks. And that injection would cost, if we didn't have insurance, $22,000. It's a lot of money.
I'm not surprised.
Yeah. Tell me why you're not surprised, sir.
So I'm not surprised. So if you look at the ever increasing cost of medications, it's not just biologics, it's not just new drugs. Existing drugs that are repackaged and remarketed, they're just skyrocketing.
But I had thought, and I'm also the son of a pharmacist, that when a drug comes off patent, I think after, is it 17 years, that the price should drop rapidly because a generic can then be made. But are they repackaging it in such a way so they can avoid the generic knockoff?
Yes, so you're right. So let's say a patent runs out, the prices drop, there's competition, but the competition means there's multiple makers of a particular product. Well, they are now, if they're finding that a certain medication, there's only fewer of it, they'll repackage it and sell it, mark it up extensively.
What, they'll change a molecule or something?
Change the molecule, change the name of it, and essentially they can drive the market because there's no competition.
What's surprising to many of us when looking at healthcare costs, we know that healthcare costs traditionally have outpaced inflation. But as I understand it, not as much since the passage of the Affordable Care Act. But what we know is that while healthcare costs are outpacing inflation, drug prices, they're outpacing generic healthcare costs, overall healthcare costs.
Very much so. So you're correct. Because of the Affordable Care Act, because of the exchange, and because of the pressure by the public that they want a lower premium dollar, hospital costs are starting to be under control. Healthcare costs are under control. Believe it or not, out-of-pocket expenses for the consumer is dropping. The only thing that isn't, that's going up, is prescription drug costs, new prescriptions and remarketed drugs.
Is that because the Affordable Care Act, for example, does not allow the federal government to negotiate for drug prices or provide other mechanisms by which entities can negotiate for drug prices?
A little bit of that, but the big reason is when we did the Federal Affordable Care Act, and in California when we put all those patient protections, for example, we have what's called medical loss ratio. An insurance company cannot profit after a certain amount, and if they do, they have to return the profits back to the consumer.
And that's happened.
And it's happened. Providers, you've heard it over and over. Fees are going down. Medi-Cal fees are the lowest in the country. The only entity that was not written into federal law was the drug manufacturers. And if you get a new drug that comes with a patent, they essentially have a monopoly on that drug medication.
The flip side, though, is it is expensive to develop drugs. I have heard figures where drug development costs top $1 billion. And so is there a concern that if we start tinkering with drug pricing, drug profits, drug transparency, that we are disincentivizing the R&D process?
I don't disagree. Yes, there's risk, and yes, there's an expense, and yes, a company, if they put that risk and expense, they should get a profit back. However, 50% of the R&D in this country is paid for by the federal government or by the university systems.
Interesting.
And get this, let me give you a statistic that's going to blow you away. For every dollar that the pharmaceutical industry spends on research and development, they spend $19 in marketing their drug to the consumer directly. So they're doing pretty well.
It's funny you say that because you see drug commercials on television quite frequently, and I was mentioning to my children, when I was a kid, drug commercials were not allowed. And so, I digress a bit, but has this been of benefit to the consumer that drug commercials are now allowed?
So it's freedom of speech. Yes, they're allowed, but how is a consumer going to know what is in the best interest for their health based on a commercial? Because what they're doing is they're marketing to the consumer to tell their doctor, give me this drug because I saw it on TV. Ultimately, you want to look at clinical trials. The prescription is going to be determined by the physician or the provider. But the drug manufacturing industry is looking at these ways to market to make even more profits.
But it seems as if, let's say the commercial's 60 seconds long, 45 seconds disclaimers.
Yeah,
You could have a heart attack, you could die.
Right.
I don't want to take this drug.
Well, I don't disagree, but obviously it's working.
I hear you.
Why would they spend for every dollar in research and development, $19 in marketing? They're getting that money back, I'm assuming, very tenfold.
So you're looking at a specific element of this drug pricing question, and that is the matter of transparency. Right. Bill pending now, SB 1010. What would your SB 1010 do?
So it does two things. It's about transparency. Through the regulatory process of the health insurance plans, they have to report to their regulators the top 25 most expensive drugs, the top 25 most used, but year over year increases, so that we know what the amount of premium dollar goes towards prescription drugs, number one.
Why do we want that information?
Well, we want that for a couple reasons. Whenever I meet with pharma, they always say, well, we're only 10% of the overall market. But when I talk to the buyers are the health plans, the state of California, which is Medi-Cal, the prisons. They say, no, we're reaching 19%. So if we can control healthcare costs for every segment of the healthcare market, except prescription drugs, and it goes up 3, 4, 5, 6% every year, something's not right.
But would that element of transparency, and there's one other element, why don't you tell us the second element, and then I'll ask my question.
Yeah, and then the second element is that any drug manufacturer that generates a new drug that costs more than $10,000 per calendar year, or has an existing drug that goes up or increases in price by 10%, they have to notify the buyer to let them know so that they can either try to negotiate a better price, or if they can't, to not have it in their formularies. It does two things.
So you're not setting drug prices?
No, not whatsoever.
Right. So how do these elements of transparency help the state of California, the buyer, the insurer, the insured?
Yeah. Two ways. Number one is transparency works. Okay, if you look at what we do at the federal government with Medicare, we're doing what's called an all-payers database. By having data, we can see where the costs are, and yes, unfortunately, fortunately, you're going to be able to get the drug manufacturers to not want to have that information out, and they're going to moderate their prices. The second part is going to be to notify the purchasers to get them prepared if all of a sudden there's a spike of an increase of a cost of a new medication that comes out.
Simultaneous with your effort in the legislature, we now know that one of the 17 propositions that will be on the ballot in November is a price control measure.
Right.
And it would ban state agencies from paying more for a prescription drug than the lowest price paid by the U.S. Department of Veterans Affairs. It complicates the debate. Is that fair to say?
Yes, I would. I'd say so. It's different. It's not transparency. I haven't taken a position, but I have some concerns.
What are they?
Here's the concern. So it's based on what the purchase for medications through the VAs.
Right.
Okay? Well, we don't know what that price is. Keep in mind, when you purchase, it's based on buying power.
Right.
The state of California, Medi-Cal, I would venture to say,
right.
has more buying power than the VA does.
I wonder, yeah,
okay?
I wonder.
So if the VA has a price here, but Medi-Cal gets it here, but now the Constitution says you got to buy it at this,
That's very interesting.
you may actually spend more money.
What does pharma say about this?
Well, I can tell you, pharma's going to spend more money to defeat this because they don't want to have anything to do with transparency or regulating
So
what they do.
your bill as well as this proposition.
Yes, there's so much opposition to my bill.
His name is Ed Hernandez. He is a member of the California State Senate, chairman of Senate Health, also a candidate for lieutenant governor in our great state of California. My name is Brad Pomerance. Just Charter Local Edition.